Hello, everyone. Hello and welcome to Resist Bill 6 webinar. Thank you for joining us from across Ontario and Canada. Great to see such a great turnout. We're creeping towards 100. We have 200 registered. I think a lot of folks will be following up with a recording as well. I can feel the solidarity brewing from all over, so I'm really grateful to have you all here. My name is Marina Clausen. I'm one of the founding members and organizers with Harm Reduction Advocacy Collective, or HAC, a collective made up of people who use drugs, frontline harm reduction workers, allies, and we have been organizing to protect harm reduction in Ontario and fight for drug user liberation for the past year. We would like to first start by acknowledging the original displaced and criminalized peoples. We are meeting on the traditional unceded lands of the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. So-called Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with multiple Mississaugas and Chippewa bands. The criminalization of drugs and homelessness is rooted in racism and colonialism, and as a result, Black and Indigenous communities have been disproportionately harmed. We hold that in our hearts as we go forward today. I am really grateful to be with all of you to break down Bill 6, the Safer Municipalities Act. So briefly, Bill 6 has two significant parts that we're going to be talking about today. So creating the Restricting Public Consumption of Illegal Substances Act to criminalize using drugs in public places and remove people who do, and making changes to the Trespass to Property Act when it comes to sentencing. So we will go into more detail, breaking down the act and its implications with our panelists. So I want to start with giving a little bit of context surrounding the bill. We're dealing with the compounded triple crisis of the housing crisis, the toxic drug crisis, and the economic and social fallout since the pandemic. Last year, 80,000 Ontarians experienced homelessness, more than triple the number since 2018, and nearly three times the number of shelter beds available in Ontario. The unofficial estimated number of homeless people in Ontario is likely closer to 250,000. That's roughly 3 of every 200 residents. There were 197 suspected drug-related deaths reported last month in April 2025 in Ontario, and we have the highest OD rates in all of the country, losing on average 8 precious lives per day to the toxic drug crisis. And we have just seen the Ford government successfully shut down 9 SESs across Ontario on April 1st. Many safer supply programs as well, safer use supplies distribution sites, and drug testing sites in the middle of this escalating crisis. The devastating impact of which remains to be seen in the official numbers, but we're seeing it right now on the front lines among our loved ones every day. In the face of all this, resistance is ongoing on the grassroots level, and our communities, through mutual aid and direct action, through lobbying, through coalition building, through awareness campaigns, and through the courts, through charter challenges, are showing up in that resistance. So some of the folks that have been leaders and critical to those resistance movements are here with us today. I'm going to start off by giving a little bit of a background on each of them so you can get to know them, and then we'll launch right in. So Diana Chan McNally, who has been tirelessly organizing around the Safer Municipalities Act since November 2024. Diana is a community worker and an advocate, and she will be breaking down the legislation into accessible language and telling us a bit more about the Encampment Justice Coalition that is formed in opposition to the bill. Rodney Kort is a litigation lawyer with HIV/AIDS Legal Clinic Ontario, HALCO, in collaboration with HIV Legal Network. HALCO recently intervened with many organizations to challenge the constitutionality of the Community Care and Recovery Act provisions, which effectively closed supervised consumption sites across Ontario. He will be reviewing the legal implications of the bill and pathways potentially to charter challenges when the bill likely passes. Mskwaasin Agnew. Mskwaasin is a member of the Salt River First Nation and a resident of Toronto. They're a fierce community organizer and leader with Toronto Indigenous harm reduction and safe consumption site frontline worker. They will be speaking to how colonial governments break their own laws to suppress Indigenous constitutional rights. And lastly, Zoe Dodd, and not least, is a founding member of Toronto Overdose Prevention Society and a longtime community organizer and a MAP Center for Urban Solution for community research scholar. She will be speaking to how Bill 6 is an omen of forced treatment and incarceration of people that use drugs to come, and the growing profitization motive of politicians that support fascist laws like Bill 6. We're gonna launch right in. So I wanna bring Diana up to start us off with breaking down the bill.
Hey, thank you for that introduction, Marina. And I'm so glad to see so many people here to learn more about this legislation. But I want to frame what we're seeing from the provincial government as a very clear assault on the rights of people who use drugs, as well as homeless people and their intersection. So, this government has actually introduced multiple pieces of legislation. So, Bill 6, which I'm going to focus on and which will be kind of the focus today, but also Bill 10, which I'll talk about a little bit as well. And of course, we've seen Bill 223, which has actually shut down supervised consumption sites. And so, all of these goodness, my cat. I have to take her off my lap because she's trying to slap my hand. Um, all of these pieces of legislation are meant to target people who use drugs, both in public, but now also in private spaces. So, in the case of Bill 6, we're really seeing a targeting of folks who use drugs specifically on the basis of their housing status, meaning that they're targeted because they are homeless on top of using drugs. So, I'll start a bit with kind of a breakdown of Bill 6. So, Ford has reintroduced this piece of legislation. We saw it before. It's called the Safer Municipalities Act, and it's something he actually has been talking about since late summer last year. And so it was introduced last December as Bill 242. Now, because the Ford government called an election, it effectively what we call died on the floor. So the bill never actually became the law and was passed. So he's actually reintroduced it again now as Bill 6. And the text of this legislation has not changed at all. It's exactly the same as when we saw it last winter. Now, importantly, this bill makes it possible for police to immediately evict homeless people living in public spaces. They can be removed immediately along with their belongings. And in fact, those belongings can be confiscated if they are believed to contain drugs. So feasibly, all of someone's belongings, including all of their important belongings, their ID, can be seized under this particular bill immediately, just on the basis of there might be drugs, maybe located inside their bag, their tent, etc. It also makes it possible to arrest people without warrant if they do not comply with this eviction order. It also means that they can be fined up to $10,000 or they can be jailed up to 6 months. And actually, all of these things can happen at the same time. So you can receive immediate eviction, you can be arrested without warrant, you can be fined, and also put into jail. So all of these are potential penalties as a result of this legislation. Um, Now, again, these penalties are triggered if homeless people are suspected to be using or in possession of drugs in public. And that actually includes inside their encampment. So it's not considered a private dwelling like my home would be considered a private dwelling, but rather part of the public space, again, that can be seized, that can be thrown out immediately if it is considered to be containing drugs or someone may be using drugs inside of that, their encampment. Now, Bill 6 also makes it possible for police to actually take somebody physically and move them from their encampment and drop them off at any social service agency. So, this is a lesser talked about aspect of Bill 6, but I think really, really important to this kind of broader scheme that I'm seeing from this government. So, this can include a heart hub. And of course, if you've been following, obviously, a lot of advocacy around harm reduction, we know that the Heart Hub is, well, actually, we don't really even know what a Heart Hub is. There is no clear model for what one is, but under the government's kind of rhetoric, it is meant to be this kind of drug treatment center that's abstinence-based. So presuming that's what a Heart Hub is, and that seems to be what the intention is, Bill 6 will make it possible to put someone on the doorstep of what is effectively a drug treatment center against their will. So We know supervised consumption sites are under fire, they're under attack, they're being shut down. Bill 6 now makes it also punishable to have or use drugs in public space. And so it also attaches onto that an inevitable form of coercion to attempt to push folks who are homeless into a drug treatment facility. And again, this model is untested, unclear, and entirely unproven. But the intention, I think, is really obvious. Um, as well, we've also seen with this province's budget and this year, so we just had our provincial budget released last week. We're seeing that budget for community service is being flatlined across the board. There's no new money for encampments, but there is obviously investment in heart hubs. And at the same time, this government has actually committed to building more prison beds this year than supportive housing units. And I think that's also really important as well. Um, this kind of policymaking, so Bill 6 is actually modeled on policies that have been developed by something called the Cicero Institute. And the Cicero Institute is a right-wing think tank based in Texas, and it is actually owned by a billionaire named Joe Lonsdale. And so the policies developed by the Cicero Institute have actually been instituted in a number of states in the US, as well as municipalities. And in fact, Donald Trump very recently undertook the largest encampment eviction in North American history by forcibly removing 200 Oregon residents who are living in the Deschutes Forest and evicting them to nowhere. And so, in the process of this eviction, you guessed it, Trump was suggesting that if they didn't comply, they would be put into jail for 6 months or fined $5,000 USD. So it is almost exactly the same kind of policy that is being used and enforced by Donald Trump that is being brought into Ontario. Importantly, we have lots of documentation of this policy in America, and we have seen time and time again, it does not work. It does not work. Housing people is what we know works. And as I said, Doug Ford, not investing in community services, not investing in supportive housing, building more prison beds in supportive housing, and in fact is only meeting half of his own housing targets. So their own government is not even meeting their own housing goals that they have set for themselves, not even by 50%. So that's kind of Bill 6 in a nutshell, and kind of the context broadly of it. So no housing, lots of jail time, massive fines that no one can pay, as well as this really clear step, I think, toward coercive drug treatment. And now, just a final point on Bill 6, just I have more to talk about with other bills as well and how they intersect, but just a final point on Bill 6. Doug Ford has also repeatedly threatened to use the notwithstanding clause to overrule any court that may rule in favor of the rights of encampment residents. So, if you're familiar with encampment legislation and policy, we've seen in Kitchener-Waterloo, for example, that a judge ruled in 2023 that it was illegal for the municipality to evict that encampment because there was not enough adequate shelter. So if another court challenge like this came up again, and in fact, we do have active court challenges on this right now, Doug Ford is prepared to invoke the notwithstanding clause in the charter to overturn those court decisions if they rule in favor of the encampment residents. So, what that will effectively do is take away the charter rights of people living in encampments for a 5-year period. They will no longer have human rights, essentially, which isn't technically true. You can't actually have your rights removed, but it is to say that they are nullified, so to speak, and that the government will not have to provide housing as per the law or shelter as per the law. So that's kind of nasty as well. And I think that's also just very much like a very concerted effort to actively oppress people who are homeless. And again, at the intersection of people who use drugs. Now, I'm talking about encampment residents, but we're not just talking about targeting folks who use drugs who have no housing. Uh, in addition to Bill 6, there is also another companion piece of legislation called Bill 10. And so Bill 10, interestingly, actually targets landlords. And that might seem like, yay, we hate that, or we hate landlords, cool. But actually, it is really problematic legislation. So it targets both residential as well as commercial landlords of people who use drugs. So when I say commercial landlords, I mean clubs, bars, restaurants, music venues, quick serve restaurants, any commercial landlord that you can think of. And also, I'm citing a lot of spaces where you actively do see people using drugs. So this is important as well. And so with Bill 10, a private landlord could be impacted, but also a supportive housing provider. And I think that's really important too. So Bill 10 actually puts supportive housing providers in a contradictory position where they must provide supports to their own residents, but at the same time, it is targeting the landlords, again, of folks who use drugs. So they're put in this position where are they acting legally or illegally as a result of Bill 10? So, Bill 10, to get into what it is, makes housing providers legally responsible if anyone in their building is suspected of drug trafficking. So, this isn't just illegal substances, it also pertains to cannabis. So this isn't just about catching people selling drugs. And I think, a lot of folks have very nefarious, kind of dark, schemy things like ideas of what that might look like. This also just means sharing drugs, but also having enough drugs, which under law can mean as little as 2 pills, that could constitute an intention to sell. So that's very, very little. But under the law, again, there's not really any prescribed quantities, but just to emphasize that it's not like boatloads of drugs that you need to constitute this intention to sell. It's actually as little as just 2 pills. So Bill 10 makes housing providers responsible if their patrons or their tenants are in possession of the proceeds. Oh, sorry, not their tenants or sorry, I messed this up a little bit. Bill 10 also makes housing providers responsible if they are in possession of the proceeds of drug sales. And there is no clarity in the legislation whatsoever if this actually also means your rent. So let's say a tenant is, making money because they're selling. If that somehow makes it into their rent, it is unclear now with the legislation whether or not that means that you are in possession of proceeds of drug sales, which that would be criminalized under this bill if, we get some clarity about that. Um, as well, if you are found as a landlord to have committed an offense, you can be fined anywhere from $250,000 $25,000 to $1 million. That's a substantial fine. Even 25K is quite a bit for anyone, including, frankly, some landlords, if we're thinking about smaller businesses or a supportive housing provider, a nonprofit housing provider, that is a substantial fine, but it can go up as high as $1 million. So I just want to emphasize that this may not be affordable, especially to supportive housing providers. So it's bad. Anyway, the picture is supervised consumption sites are shut down. You cannot use drugs in public. Okay. At the same time, if you are using drugs in public, police can come, they can remove you, they can take all your things, and they can just drop you at the doorstep of a drug treatment facility against your will. But also, if you live in private housing, market housing, or you live in supportive housing, your landlord or the housing provider can be pressured to evict you if you use drugs, or else they will face a potential liability of up to a $1 million fine. So it's a picture, I think, across Ontario that's really important to keep in mind that it's not just about Bill 223, supervised consumption sites being shut down. It's also about these other pieces that intersect together to make it impossible to exist as a person who used drugs in Ontario, whether you're in public because you're homeless, whether you're in your own housing even, or even if you're in a third space like a bar or a club, and I'm a DJ, I have all these records behind me. If you rave, there are drugs around. So it also puts music venues, people who work in the music industry at risk as well. Altogether, this is also how we start to legislate forced drug treatment without actually legislating forced drug treatment. And as we know, drug treatment in Ontario is also unregulated, completely unregulated, and largely privatized. So this is all about pushing people, not just, it's not toward a health service, it's an unregulated, privatized service that makes a shitload of money. Forgive my language there, but that is what is going on. So we're really trying to monetize or extract money from people who use drugs without actually addressing people's real needs, their safety, and their rights. So it's not about wellness. It is not about health. It is not about human rights. It is not about the things that people actually need. It is all about money. So that's kind of my breakdown of what's going on. Hopefully that was clear. Thank you. Thank you.
That was incredibly good. Thank you so much, Diana. I really appreciate it. I want to also like address some of the questions that are coming up a bit, and I'll ask them of you if that's okay. So, one question was, how does Bill 6 compare to current legality of substances, and does it have more to do with like a penal response?
I think the next speaker will probably be able to speak to that a little bit more.
Mhm.
I'm not familiar with all of the legislation
Yeah.
about what is articulated as like reasonable grounds to suspect that you might have drugs on you. That
Mhm.
would come through case law. But in this case, if we think about the CDSA, for example, the fines that are being set with Bill 6 are actually higher than they are in federal law. They're double, essentially, what we've seen in federal law. So that alone is unique. And on top of that, I think the important thing about Bill 6 is that, again, it is targeting people based on their housing status. That is very clearly outlined in the bill, which should be considered unconstitutional. So there are no laws at present that have that specific targeting. And yes, it is targeting people on the basis of using drugs, but it also becomes an excuse to remove encampments from people's sight lines because they're tired of seeing them. So it also, I think, is going to be leveraged in a much different way than we've seen with other forms of legislation that are similar.
Thank you so much. I appreciate that, Diana. And we're gonna have more questions probably for you at the end. But feel free, guys, to pepper them through in the Q&A, and we'll try to answer them as we come. We're very, very excited to invite Rodney now up. Rodney is from Halco and will be speaking more to the legal implications of Bill 6, as well as the potential pathways to a charter challenge. So if we can welcome Rodney's joining us by phone. And thank you, Rodney, for being here. If you want to unmute, Rodney, are you there? Okay. I think we will come back to Rodney, and let's actually move forward to Mskwaasin, who'll be sharing with us today. Thank you for joining us, Mskwaasin.
Thank you so much for having me. As mentioned, I work with Toronto Indigenous Harm Reduction, and I also work at an overdose prevention site. I'm a frontline worker. Toronto Indigenous Harm Reduction predominantly supports Indigenous people who are unhoused and predominantly use drugs. A large majority of them are seniors, and a good portion of them are actually residential school survivors. And what hits me the most about the legislation that we're seeing is that our people have already been displaced. And this is another major violation that will disproportionately impact our community, just as the same as legislation that's already come through is going to disproportionately impact our community. I wanted to speak about in regards to Indigenous encampments and of individuals on public lands where there's no other forms of shelter available, and what are the roles of the federal, the provincial, and the municipal authorities. Um, so there actually must be specific legislative authority. Any municipal bylaw must conform with specific delegation of authority provided by the legislation of the province. So there's very few limits on the use of public lands by Indigenous people. Per our treaty rights, Canada has agreed to many treaties. Anywhere you stand, well, except for large parts of BC, there's actually you're on treaty land. So there's constitutional, there's international and national laws, which provincial and our municipal authorities cannot limit. Canada's constitution gives federal parliament legislative authority over international, interprovincial, and Indigenous issues. There's an issue of who can enforce a law or a bylaw related to health and public health, right? So what, can, for example, Toronto Police Services actually enforce? not saying that they won't attempt to, and that there will be, great violence seen if this law is passed. And but this is like actually who can enforce these laws. So municipal police have some authority to enforce valid criminal and other laws. Other quasi-criminal enforcement would probably have to involve national police, so the RCMP. It's not believed that municipal police have specific authority to enforce public health law, unless it's under some specific provincial or federal law related to peace, order, and good government, power, and constitution. So there are provincial and there's federal commitments to reconciliation to Indigenous people, including the rights of freedom and access to the use of public lands and freedom of movement. Governments can't say they're relying on some policy, published or unpublished, to enforce rules it claims are enforced. It must be duly enacted by law and publicly accessible. So, in summary, colonial governments break their own laws to suppress Indigenous people's rights. Um, and all levels of government are shirk the responsibilities of and commitments made to Indigenous people on other forms of government, right? So we're talking about Indigenous nations, and we're talking about nation-to-nation relationships. So all levels of colonial government were created to circumvent and suppress Indigenous and legal traditions and our spiritual traditions and our cultural traditions. So a perfect example of this is Indigenous people who use drugs. We are the main demographic of service users of safe consumption sites. And so now you've closed down all the places in the city where Indigenous people access pathways to primary care, healthcare, all forms of care that they need, and so you're displacing them not only from these places where it might be the only place in the city that they feel safe, and now you're actually displacing them from their encampment or their tent or wherever it may be. So it's you are making it more unsafe for a population of people that make up the biggest demographic of unhoused people in this country. We make up the biggest demographic of people who are criminalized in this country, and there has been no consultation and there has been no consent with our communities. And this is a huge, huge disgrace to any of the commitments that have been made by all levels of government in this country. There needs to be an intervention of even our own nations to have a say in what's happening here. And it's not up to um, it's not up to a colonial government to govern our sovereign Indigenous nations. So it's really awful as a frontline worker, someone that works with residential school survivors. I work with people who have traditional knowledge, have lived their lives on the land and are displaced from their community and now live in urban and Indigenous environments. And they are time and time and time again, their constitutional rights are infringed on. And yet it is predominant. We are the last people, we are the last part of the community to be heard from or to be considered. There's very little representation of Indigenous people who speak to what it means to be homeless or houseless in an urban environment. And there are commitments made to house Indigenous people, and the housing that we do see is unsafe, it's unsanitary, and it's traumatizing for people. And we're talking about people who go from one prison to another, and it will be devastating. It will be devastating. And we're talking about a population of people that face the most stigmatization. And this is all relates to settler colonialism. This is the modern day settler colonialism. This is just another way to displace us from our own lands. Um, and it's I'm anticipating that there will be a great amount of our people who we know and we support them that can't pay these fines and will have no other option and we'll end up in prison. This is another way to criminalize and imprison our people. So it's quite devastating. And I'm glad that we're all coming together to take action on this. And you know, we can only keep talking about it and hopefully take action to educate people who are going to be most impacted by this and what are their rights and how can we support them. And so I look forward to like hearing those ideas and having those conversations with people and just 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 pray. I'm just praying. So thank you so much. I unfortunately won't be around at the end to take a lot of questions. I have to run to another community event, but I'm really glad that I could be a part of this conversation and learning from you all. Thank you so much.
Thank you so much, Mskwaasin, for speaking to like the constitutional suppression of Indigenous people's rights and like grounding us in the real fight we have against the broader settler colonial agenda that is playing out right here. We know that Indigenous folks are disproportionately impacted, and yet we're not seeing follow through on addressing that from our colonial governments and from our agencies and communities. There was a question for you about, are there any statistics about Indigenous usage of safe consumption sites? Which the commenter said, like, I know it's disproportionate. Are there statistics?
So I think that are there's statistics around um, people who have passed from overdose. There's statistics around um, in like population of Indigenous people who use drugs, but it's very there's actually it comes down to privacy laws
Yeah.
and keeping people safe. And so that's why there aren't definitive numbers of people who use safe consumption sites that are like known by the broader community, but there are efforts being made to gather that information in a way that keeps people safe. Um, there are individual safe consumption sites and community health centers that do have that information, but it doesn't paint the picture of like the broader spectrum of, say, how many Indigenous people in the city of Toronto are using safe consumption sites versus like provincially or municipally. So.
Absolutely. And I think that like it's this line a little bit of walking like you're first of all, this is a community that's been highly surveilled and like watched and like you want to respect also people's like self-disclosure and stuff like that. But I think we ultimately need to just trust our community leaders and trust the Indigenous community leaders that are like explaining how much this is impacting them and how much they're accessing and engaging with these services. So I'm looking to Toronto Indigenous harm reduction for a testament on that. Okay, so I want to invite Rodney Halco, who is going to give us a bit of context, a little bit of legal context on Bill 6, as well as potential pathways to Bill 6. Sorry, to challenging Bill 6 through a human rights charter challenge. So please welcome Rodney.
Hi, everyone. Can I just check that I can be heard?
Absolutely, you can. I can hear you.
Excellent. Hey, everybody. So just very quickly, I'm a litigation lawyer at Halco. We also work very closely with the HIV Legal Network, which is based in Toronto, on legal issues and charter challenges related to people living with HIV in communities disproportionately affected by HIV, including, of course, people who use drugs, Indigenous peoples, two-spirited LGBTQ populations, and racialized communities. So I'm just going to cover a few key arguments that are pathways to challenging the constitutionality of Bill 6 if it's passed, under Section 7 and Section 15 of the Charter, as well as an argument that the legislation encroaches on an area of exclusive federal jurisdiction regarding criminal law powers, and that would be under the Federal Controlled Drugs and Substances Act. And if I have a few minutes at the end, I'll also talk about the importance of the representative applicants among populations affected by the challenge legislation and the important issue of evidence required in support of charter challenges. So applicants and interveners can and do make all three arguments and more in applications. I just want to focus on the ones that I think are most directly at play with respect to Bill 6. So Bill 6 would arguably breach Section 7 of the Charter, which guarantees the right to life, the right to liberty, and the right to security of the person. And those three rights are analyzed separately in case law. So in order to prove a breach of Section 7, the claimant has to prove that the law infringes one of those rights, and then that if the law, in fact, restricts or deprives the claimant of the right to life, liberty, or security of the person, then that deprivation must be in accordance with what's referred to as the principles of fundamental justice. And those principles are underlie what the court says are notions of justice and fair process. In particular, laws cannot be overly broad, they cannot be arbitrary, and they cannot be grossly disproportionate. And I'll explain each of those principles shortly. So just in terms of the right to life is engaged whenever there's a law or state action that imposes an increased risk of death, either directly or indirectly. And applying this to Bill 6 Schedule 1, I think it's clear that the definition of public place, which is essentially everywhere the public has access to, it's much broader than similar BC legislation, which is also being challenged, and law enforcement involvement with people who use drugs, including homeless population and those forced by necessity to live in public spaces, results in the risk of displacement, isolated or hidden drug use, and the associated increased risk of overdose, including in particular, there's evidence of increased risk of overdose after custody. And Schedule 1 authorizes up to 6 months imprisonment and $10,000 in fines, which is, absurd given the population at issue. There is a case law on the issue of adequate shelter that was decided in 2023. So the ability to provide adequate shelter for oneself is a necessity of life that falls within the right to life protected by Section 7. So I'll talk now about the right to liberty. The first is the protection of persons in a physical sense, such as when there is a risk of imprisonment or the threat of imprisonment. And the second protects the sphere of personal autonomy involving inherently private choices that go to the core of what it means to enjoy individual dignity and independence. So again, in applying this to Schedule 1 of Bill 6, it's clear that this would fall within the right to liberty given the threat of incarceration. Finally, the right to security of the person is that this right includes both physical and psychological security. So it includes the security of the person to control his or her own bodily integrity, where a state action has the risk of impairing a person's physical or mental health. And both Schedules 1 and Schedule 2 arguably engage this right, given the coercive measures that are available to law enforcement under this bill. So I'll look now at the issues of arbitrariness. A law is arbitrary if its effects are either unrelated to the objective of the legislation or not capable of fulfilling its objectives. And here it's arguable that the purported objective of Bill 6, which is public safety, is actually unrelated to the effects of the bill, which would arguably have no effect on public safety and have significantly adverse effects on already excluded and disadvantaged populations. The other principle that's at issue under Section 7 is overbreadth, and that is when the objective of the law prohibits and penalizes conduct more than is required to achieve its stated objectives. And here the schedules include very broad provisions in terms of prohibition and penalties on drug use in any publicly accessible place. So again, there'd be a strong argument that this law is overly broad in achieving its objectives. And finally, gross disproportionality are laws that may be connected to the objective, in this case, public safety, but whose effects capture conduct that is unrelated to the legislative objective, so that they're grossly disproportional to what would be required to achieve the objectives of public safety. So I'll move now to the Section 15 argument. Section 15 guarantees equality under the law and equal protection benefit of the law without discrimination. And again, it depends on the specific grounds that are either enumerated in the Charter or been seen as analogous to those grounds. And to succeed, a claimant has to prove whether the law, either in purpose or effect, and that effect is important, creates a distinction based on one of these grounds. And secondly, if so, is the distinction discriminatory? In other words, does that distinction impose a burden or exclude from a benefit the individual or group that has a result of perpetuating or exacerbating a disadvantage and exclusion? The Supreme Court has taken kind of a contextual analysis to discrimination, which can be based on multiple or intersecting enumerated and analogous grounds. And I think that's particularly important in the context of the provisions of Bill 6.
Thank you so much.
So I'll leave to the Q&A if people have any questions about those arguments.
Thank you so much, Rodney. I wanted to ask, so these are there's a lot of formal charter language that goes around, and it's a little bit hard sometimes to process and understand. If you were going to put it into the plainest of language in terms of what the areas of focus for the charter challenge would be, how would you describe that?
So, I mean, I think the strongest argument is that the people affected by this legislation are being deprived of their right to life because of the risk of death, for example, due to overdose or use of drugs in other places. And if a charter argument succeeds on Section 7, it's very difficult for governments to justify that because they're considered very fundamental. So, the right to life, entails, the risk of death either directly or indirectly by the legislation. So I think, in terms of the affected population, in terms of people who use drugs, that's fairly clear in terms of the evidence that's available, either in terms of the clinical evidence or the social scientific evidence. So I guess hopefully that makes it a little bit clearer in terms of the rights that are at issue and how they relate to the populations affected by Bill 6.
Thank you so much, Rodney. I really appreciate that. That helped to bring it into focus. We know that people who use drugs and homeless folks are more likely to die and more likely to die because of criminalization. And I think we have a pathway here to challenge that through the Human Rights Charter. I want to welcome Zoe Dodd. Zoe is going to give us a bit of context about Bill 6 being an omen of forced treatment and further incarceration of people who use drugs to come. Thanks for joining us, Zoe.
Thank you. Okay, I first want to just start by saying that involuntary treatment already exists in the system. So we're hearing a lot lately about involuntary treatment, forcing people into treatment programs, etc. Involuntary treatment has actually existed in the system for decades. People are forced into treatment, whether by their employers or child protective services. They're forced into treatment by the courts, by court orders and conditions. And so this idea that it doesn't already exist is not true. We have drug treatment courts across the country. Drug treatment courts evidence and their outcomes is not that great. If the requirement is forced and long-term abstinence, then people do not tend to meet that goal by the courts, by those who work as therapeutic arbitrators. And so, what's really concerning about what's happening now is that we could see this coming for many years. So, as someone who's worked in addressing the overdose crisis for the last decade, I think I knew back in 2017 that this was something that conservative governments were going to try to push for, was to involuntary treat people when the issue isn't about quote unquote addiction. The issue is actually about a toxic drug supply that's killing people. Sorry, there's a car alarm going off in the background. Um, and so you could kind of see the writing on the wall that this is where governments would move instead of wanting to actually take care of their people. And so, it's been rather frustrating to see them build the scaffolding and the architecture for involuntary treatment and not provide the kind of care and supports that people need. So right now we have a system where people are waiting months, weeks to get into. We have two medical detoxes in the whole of the province of Ontario. There are long wait lists to get in. One of them is at CAMH, one of them is Humber Valley. There are people in the north who do not have access to anything. But access isn't the only problem we have. As Diana was saying, we have a system that's completely unregulated and driven by money. So there are a lot of people who are making enormous amounts of money off of the drug treatment system. And that goes with the same people that are advocating for forced treatment. They've also been profiting off of this system. And you can see there's a pattern across the country of people who own luxury treatment programs, who are getting contracts with the government, who are sitting as aides to the government, like Marshall Smith in Alberta, who is recently in the media because he's suing the government and suing people who tried to highlight that he was giving contracts to his friends. This is something that actually goes on in Ontario as well, and we are not sure where those contracts actually go. And if you ask Ontario Health or the Ministry of Health about the actual treatment system, they can't give you a lot of definitive numbers. They can't tell you where things are going, where money's flowing. But we do have two Ontario auditor reports to look to that one in 2019 and one in 2024 that both talk about how money is being misspent, how money is flowing. There are doctors who own multiple clinics, and if we're going to talk about what treatment is, treatment in some people's minds, especially those who are talking about involuntary treatment, is about injecting people with an opiate substitution therapy or giving people pills. And it's all about medication. That's, addiction medicine. So I'm going to put this in quotes because I actually don't, from a personal point of view, as someone who's been working with people for over 20 years who use drugs, I don't feel like this is good care for people. It is rooted in psychiatry. It is about putting people on medications. It doesn't take into the historical context of people's lives. It doesn't take into their other identities. It's just about your relationship to a substance. And we don't talk about that in terms of alcohol, but we talk about it in terms of illicit drugs. And I would say some of these people are like the foot soldiers of the drug war and are really ramping it up. They're calling prison cells in Alberta, where they've just passed the Compassionate Care Act, as therapeutic living units. They're calling a cell a therapeutic living unit. So someone can force someone into treatment. The criteria in Alberta is quite vague. You have to be a harm to yourself or others, but seeing how the supply is quite toxic and people are overdosing often, someone could make the argument that a person is a harm to themselves and at risk of overdosing and dying, and then be like taken to this commission. So you can be apprehended. People are already forced by family members as it is, but you could be forced by your family, by a police officer, by a social worker. You then go into detox for several weeks before you see the commission. And so the point there is they want to stabilize people, put them on certain medications, but actually, the only replacement therapy we have right now is for opiates. It's not for stimulants. People do get some of that, but it's quite off-label. And then alcohol withdrawal is another thing that people really struggle with. And then there are some medications that do help people with cravings. But at the same time, this isn't enough. And so they're building out a system that is looking at calling it therapeutic communities and using one method. So, one methodology to say, this is how we're going to treat people, building two prisons in Alberta, one north of Edmonton, one north of Calgary, that will house hundreds of people. So, often you'll hear arguments from people who are for involuntary treatment who say, well, this will only be for a handful of people. It's just not true. This is the architecture to create patient prisoners. There's money that's involved. There's people who make money off of prisoners. They're already looking to expand this in prison here in Ontario, where we do have high rates of overdose, where there's lots of issues within prisons where prisoners are mistreated. So again, like forcing people against their will can cause significant harms, but also people do not have the tools then to advocate for themselves. They're not lawyered up inside. There's huge issues with that. Indivior is the company that creates Sublocade and Suboxone. And I'm just going to highlight this. I know this is a lot of information at once. But there is something about Purdue that we just didn't learn. We didn't learn that from, the OxyContin scandal about how pharmaceutical companies should not be advocating to doctors and others. But here in Canada, we have very loose rules around this. We can't see how much money doctors are making from pharmaceutical companies, where they're taken out for lunch, who's funding what. But Indivior is a company that has had to pay out billions of dollars, millions of dollars for mistreatment of prisoners in the United States, millions of dollars here in Canada for suppressing the ability to get a generic drug on the market, which would cost the consumers much less and us much less money, and have been funding strategists, paying for strategists and lobbyists to lobby governments to, put forward their drug. Sublocade. And one of the things about Sublocade is that they claim that it works and that people, it works for people for 30 days. But actually, when it comes to fentanyl, we know that methadone is actually superior in terms of an opiate substitution, and that Sublocade does not last as long as the program monograph, as a product monograph states. So there is all of this very nefarious stuff. Not all of it's nefarious. I think some people have good intentions, but for the most part, those advocating for involuntary treatment do not look at the like decades and decades of evidence that we have from around the world that shows that forced detention of people who use drugs actually increases their risks of death. It increases their risks of dying outside when they are released. It increases people's risks of like homelessness. It doesn't actually address the issues in people's lives. It punishes them further. And I think many of us agree that we want a future that is more about caring for each other and building a more compassionate future. And this is not about building a compassionate future at all. This is about racial and social control and using medication as a form of that. And we've seen that in the psychiatric system. We can talk to consumer survivors. We have so much evidence to show, where this goes for people and the harms that happen to people who have been forced into treatment. There will always be those people who will say, I went to jail, it was great. Like I came out and I'm like turn my life around. But for the most part, being incarcerated, going in and out of the system, actually causes so much chaos and harm in people's lives. And for many of us who've been advocating, we've been advocating to not ramp up the drug war, to actually invest in communities, to take funding out of police budgets, to take funding out of incarceration, not expand it, not expand private prisons. And this is where we're headed. The government talked about heart hubs. They're setting all this the architecture up for everything, including public drug use outside by closing supervised consumption sites. And they still have not given the money to the heart hubs. And they've said, no one will die. This is what's going to happen. And so it starts to make you think, what is the use of a heart hub? Will this be the scaffolding for involuntary treatment? Will this be the entry point? Because it's clear the government doesn't care about the people who will die and have died because of the closures, which is exactly what happened in Alberta. So, it started with doctors like Dr. Robert Tanquay is one of the leading doctors who, was on the report to defund supervised consumption sites. They defunded the site in Lethbridge, saying that, oh, look, they misspent money. Turned out it wasn't true. 90% of the people using that site were Indigenous. It was one of the busiest sites in the world. Lethbridge is a small city. And then he worked to create a private luxury treatment center called the Newley Institute, where people could get ketamine therapy, and it was for cops and paramedics and fire. And then he went on to be the police commissioner for Calgary. And now he's the person that's implementing this new model of involuntary treatment. And so I think, one of the reasons why we're talking about this is sometimes what we think it sounds like a good idea in the background is actually something that can be quite awful and harmful and is not the direction of the society that we want to live in, and will actually increase overdose deaths, which it did in Alberta. This will not stop people from using drugs. It actually might contribute to people using them more, which is what we do know about forced treatment. Okay, I'm done. There's so much I can say. I'm actually in the process of creating a database with all of the investors, all of the luxury treatments, all of the people who own stuff, to just show to the public how this is already a privatized system and how privatized systems can get away with giving people really terrible care, make money, profit, and have no oversight and regulation. So, like, you and I could go open a treatment center tomorrow, and we could just do that and advertise it, and we could make money, 30,000 a month off of an individual. We could get contracts from the government if we had a good lobbyist like Rubicon or Navigator or many of the lobbyists that exist today that are lobbying the government constantly. So I'll be releasing that in the next 2 months. Thanks.
Thank you so much, Zoe, for rooting this in the reality that this bill is about profit seeking, that it's not about compassion, not about care, not about finding people resources, but we have to kind of trace and follow the money to realize that behind all of this is an attempt to further profit off of the war on drugs, which has been an ongoing project, and this is a bill that's contributing to that. So thank you so much. I want to thank all of our presenters for giving us some like powerful, powerful content. If you have any Q&A questions left, I'm going to talk for a few minutes just about the ways that you can get involved and plugged in from here. So drop them in and I'll try and answer them if anything comes up. And also you can follow up with an email if need be. So first off, I just want to say that if you're looking to get involved, there's several different pathways. One is individuals can sign a petition against the bill. This is something that Encampment Justice Coalition, which we are all a part of in our organizations here on this panel, and Diana is leading and organizing. You can sign a petition. I'm going to drop that in the chat as well to make sure that everybody can sign on to that petition. And you can also attend your local Ontario-wide rally to resist Bill 6 next Thursday, May 29th. So the one in Toronto will be at noon at Queen's Park on the Ontario legislature. If you do not know your local location, I would suggest looking up like some of the local harm reduction groups in your neighborhood, and likely they are the people that are posting this. Otherwise, we'll follow up in the email maybe with more details when we have them. If you're in Toronto, you can also come to the Harm Reduction Advocacy Collective meetings. They're from 6 to 8 p.m. every Tuesday at College Street United Church, right by Bathurst College. Our next meeting is actually like a community barbecue, and it's the perfect opportunity if you want to get involved. It's at 7 p.m. until late, Tuesday, May 27th. All are welcome to attend. And then if you would like to get more involved in provincial-wide harm reduction organizing and part of things like resisting Bill 6, you can also email hack at HARM R3 DUCTION. So harm reduction with a three saves lives at gmail.com. I'm going to drop that in the chat and we can connect you to the province-wide organizing that's been happening. Thank you for staying a little bit late. Thank you to our panelists and to all of you for coming out. Oh, I'm seeing a few questions come up. I want to make sure I catch a few of you if you're okay with that to lead. So, for Zoe, is there input from the medical community, i.e., withdrawal management, treatment, hospital staff regarding these bills?
I mean, not that I know of. I actually work at Unity Health, and I know that there are doctors who are opposed to forced treatment, but there are like lots of issues with actually the ministry even funding substance use treatment, substance use support within hospitals. That's like a whole other area. And
Mhm.
there are a lot of doctors actually who are in support of involuntary treatment or kind of sit on the fence. I think partly because when it comes to substance use treatment, a lot of it is about control already. Some of the ways in which it's delivered is quite punitive, like having to go to a methadone clinic or OAT clinic, as it's called. And like the ways in which they use like urine drug screens or they have video cameras in the toilets to watch people as they do a urine drug screen. Like it's already set up in this kind of punitive way, like take a carry away. So that's like the dose that you would get to take with you so you could like live your life and not be just going to the clinic every day. And then a lot of the doctors who are like in favor of involuntary treatment also worked hard to get rid of safe supply. And some of them had, worked against some of the harm reduction initiatives. So it's like hard to know who's like actually on side. And so if there's anyone from the medical community here who, opposes the kind of like involuntary treatment, and knows that the system is so broken that we actually just need supports that work for people that should be evidence informed, but also should be culturally and religious and spiritually appropriate, as well as gendered appropriate. A lot of the treatment is mixed gender. A lot of it is like 12 step. That is a Christian based, program. So, people are not being able to access things that actually they say for themselves that would work for them. We need a system transformation. We need people who these things have not worked for to be able to be part of that transforming. And we need the medical people out there who are against this kind of carceral care to speak up and to join us in this fight. Because I know a lot of people go into that kind of training because they want to deliver compassionate care. They don't want to create patient prisoners.
Hmm. Thank you so much, Zoe. I do want to take one more question before we go, and if there's anything that any of the panelists, if you see in the Q&A, something you can answer also. For maybe for Rodney or someone who's familiar with the law a little bit more, could advocacy to federal governments that results in updating the Canada Health Act to include universal health coverage for mental health, including addictions and harm reduction, remove provincial jurisdiction? Anyone who wants to take that? Maybe Rodney? Maybe Diana?
Rodney's gone, man. But I'm still here. Hey, Catherine. I don't know. I think I think with this government, we may not have them. I don't think they're going to be very amenable to something like this. And there seems to be a constant downloading, as you know, of these kinds of resources to the point where we have downloaded the responsibility directly onto homeless people, and people use drugs themselves in order to provide their own services to their own communities. So the idea that it could be uploaded, I think, is unlikely. I will say that in the past year, I have advocated to the Minister of Housing for an encampment strategy nationally. Their response was to only give us about $250,000 across all of Canada for encampment responses without having a human rights framework. So I feel like that's where we're at with how the federal government is leaning on issues like folks who use drugs and encampments. And the likelihood that they will be any more responsive than the province, I think, is fairly low. That's just my read, but it's not to say it's not worth trying. Everything's worth trying, but I don't know that it's going to be an efficient use of anyone's energy.
I mean, I think, and the issue is, it's like they all use this as a political, this was like political football these last years to buy votes and to have elections. And it's just like really hard. It's like when something becomes unpopular publicly, then suddenly they, they decide that they don't want to do this anymore. So, decriminalization was something that was kind of on the table, kind of. And then now it's just like, oh no, we can't do that. We need to like force people into treatment. Oh, we need to like look at the evidence around supervised consumption sites, even though it completely exists. Like, we're trying to fight, like our enemies aren't, it's not the same anymore. There are so many lobbyists and strategists that are like paid for by who worked for conservatives who are working lobbying government, who have access to their ears and are giving them information, telling them what to do, how to do it. And there are also people with a lot of money. So, like in the United States, we have this similar thing happening in the US and in Canada. The way that they're approaching encampments, the way they're enforcing public use, it's all the same. It's, they don't want to deal with the housing crisis. They don't want to deal with the toxic drug crisis, because to do that would have to be to systematically change our whole system. Like, we'd have to actually deal with developers. We'd actually have to deal with drug trafficking. We'd actually have to deal with the like this whole system that's built up in this particular way that governments do not want to do. They don't want to bring down housing prices. They don't want to deal with landlords. So, it is a particular, these people are unserious about dealing with the issues that we have, and the ways in which they look to solve them are not solutions. They're locking people away, causing more harm, and materially depriving them even more while making money off their backs. So yeah, so I think our push is again to twist that narrative around and to talk about the world that we actually want, even though it feels so massively hard right now. I mean, we have genocides happening, we have fascism growing, we have bubble protest laws being passed today at city council. I mean, it's really fucked up. And we have good humans out here who want to do good in the world and still want to build together, and that, this that getting involved in this and fighting back around these things is important. Many of us have experienced so much poverty and harm and homelessness and all of these things. And we all know that it's not because you're using drugs. It's not because of this. It's like you can't fucking pay rent. And so that's again, like our focus has to get back to these, like the material deprivation of our lives and the struggle that we're all having. So, yeah.
Thank you so much, Zoe. We're going a bit over time, but I just want to, someone asked about the SES court case. I just want to say that we're in the process of the judge has asked for more evidence. He attempted to do an injunction that would allow technically for the 250-meter rule to be lifted, but as it stands right now, everything was closed, all the 9 sites closed regardless, because it was a systematic effort to already like defund them in advance before the legislation, and to like essentially like gag and control them until the legislation went forward. And so we're still in that fight, but further evidence is being asked for, and we're hoping that an expansion of the injunction will take place. Stay tuned with HAC and Toronto Indigenous Harm Reduction and Toronto Overdose Prevention Society and Encampment Justice Coalition for updates both on the fight for SESs, on the fight against Bill 6, on the fight essentially for justice. This is a long road that we're walking together, but we need to stand tall with each other, keep fighting, and showing up for each other, because that's all we can rely on is each
And
other.
I
So
just want to say something about incarceration, because like this is what this is about, right? We're talking about incarcerating people. What's existing, what's happening already are human rights violations happening within the system, forcing people into treatment, these kinds of conditions. There are people who've tried to get access to healthcare inside these institutions, within prison, who've been trying to access like opiate substitution therapy when they come in and can't. So right now we're blaming prisoners, saying like, when you come out, you're doing this, you're doing that. And that is not real. That is like the bail system, all of these things. It is hard to get bail. That's why there's like 90% of people at the Toronto South Detention Center on remand. They have not gotten bail. So we can't forget about about prisoners because we're about to like our governments are about to embark on further fascist and authoritarian ideas and pushing through legislation and bills that will incarcerate more people. And if you don't think it can happen to you or your family or people you know, that's wrong. That's not the direction we're headed in. And so, we can't forget about the people who are already locked up. We need to dispel the myths about bail and probation and all of those things. They're just not true. It's just not that easy, and the conditions already exist. And so some people might find this like hard to hear and maybe don't understand it. I'm happy to have conversations with people about how probation, parole, conditions, all of that already functions and works. Because I think people believe that it's completely broken, but constantly know people going inside, sitting there for months, being found not guilty, having served out a lot of time already. So.
If I can piggyback, I know we're over time just a little bit. I just, I mentioned earlier that this government is investing more in prison beds than they are in supportive housing, which is true. And so we have a net 517 beds that are going to be added to the system within the next year. And I think importantly, these are going to be built with private contracts. These are going to be what we call P3 contracts, which is our public-private partnerships. So the public, being the government, is partnering with a private firm essentially to build these jails and create these beds. And so at this point, service delivery is not privatized, but the construction is. And we are just a skip away, I think, from actually also privatizing service delivery in jails as well, which we already know that the conditions and the services themselves, services, are egregious. And we could see even less oversight over these spaces as a result if this is the direction that we go in. That's me speculating, but I think it's speculation that's based on a history of actions by this government.
And it's already happening. You have it happening in Thunder Bay. You have it happening in Indigenous communities. When we talk about Edmonton or Calgary getting, treatment facilities, the therapeutic living units, those are majority Indigenous people that are going to be locked away in those units, and then are going to be under like this therapeutic community kind of model, which has a very long history of its own abuse. And I would just, if people are interested, look up Synanon and Charles E. Dietrich and sort of the history of therapeutic communities. And the people who are like pushing for this are from a group called the Recovery Oriented Systems of Care Group. And they have created a model called the Beckerian model, and that's what they're using in the prisons. So these are like private ideas, private ways of making money through private public partnerships. They're suddenly getting public contracts, but they're still doing it's still privatized. And then that doesn't even include the kind of labor that's done inside prisons and all the other kind of regimes that can happen there that can make people money, and also racially and socially control people and use techniques to still try to do like assimilation by like pushing certain ideas onto people that may not be their cultural, spiritual, or religious beliefs. So a lot to unpack, a lot to think
So
about.
much.
Not conversations we're normally having here, but we need to be having them more. And I really I thank people for listening to it because I know a lot of people are unaware of how the drug treatment system works. A lot of us are meant to believe and we're told to believe, oh, this is a really good system. People need treatment. Treatment's great. Treatment's effective. That is just not the case, and we need some significant oversight of those programs and how they operate. And we need to listen to people who've been to them many, many times. I always tell people I work with, you didn't fail that program. That program failed you. It didn't offer you what you needed, and it should have had those things for you, but that's not how the system is built.
Thank you so much, Zoe. And thank you, Diana and Mskwaasin and Rodney, for all those powerful words. I want to make sure I see every single one of you people that's in Toronto at Queen's Park next week, Thursday, May 27th at noon for the rally. We need to show up for each other, boots on the ground. We need to have these conversations more. And so please look out for a next webinar, which we hope to have to further like expand on how Ontario is trying to work us towards the Alberta model. So let's like keep on having these conversations. And thank you so much to everyone who joined us. Good night.
Thank you. Thanks for hosting us. Thanks, Lorraine, for your help.